What's up, everybody? It's your boy Jamie Slott, and today we're gonna do an IV insertion on a mannequin. Let's go into the room. Okay, so we're gonna check the MAR, make sure that we have the orders to do the IV. We're gonna gather our supplies. We got all our stuff gathered over here. We're gonna wash our hands, introduce ourselves to the patient. Hi, my name's Jamie. I'm one of the nursing students. I'm gonna be giving you an IV today. Do you understand this? They nod. So I assess their ability to, if they're like independent, if they can tolerate it, or if I need to get some help and help hold them down or something, or if they're unconscious, that'd be good too. Then, do you have a fear of needles or a history of passing out? Nothing like that. Okay, so if they had a history of passing out, I'd lay them completely flat. And I'm gonna bring the bed up, and I'm gonna ask them their name and date of birth. So, and check their allergies. Do you have allergies to iodine? Nope. Okay, and then name and date of birth. He knows it. It's correct. Bring the bed up to a working height. I'm going to put a towel underneath his arms, that way we don't get anything on the linen. We're going to be putting in a saline lock just in case we have to give you any medications or any fluids later on, and that way we can get some blood work if the doctor orders some too, okay? So that way we won't have to poke you again later. We'll just poke you once now and then get all the pokes out of the way, okay? Okay, so I'm gonna select a vein. You want one that's nice and straight. He has a nice one right here that's nice and straight, so we could use this one. And we're gonna apply the tourniquet at least 20 centimeters above where we're going to insert. I don't want to do it yet because I want to make sure I get all my supplies and everything. Get a pair of gloves. That's extra large. We're gonna wash our hands. If he has crappy veins or if you can't see them very well, then you can put a warm compress over the arm for 10 to 15 minutes to help them pop. Otherwise, after you put the constricting band on, you can have them make a fist a few times, and it'll help bring the blood into the extremity, so that way the veins will pop out a little bit more. So we'll put that on now just so the veins can pop out a little bit better. Not going to leave it on for over 2 minutes, otherwise we're going to loosen it up, give them a little bit of a break so we can do it again. Get all of our supplies ready. We're going to not touch the top of that tubing, it's still sterile, so we don't have to wipe it off. Connect that. Then we're going to prime it so it's primed all the way. I can set that back down. Alright, got our alcohol swab. And we can open up our 2x2. Alcohol swab in the arm. Going in a circle, making sure not to go back over it when you clean it, so that way you don't drag all those contaminants back over the clean site. Going at a 15 to 30 degree angle in line with the vein. Get our flash, lower, advance a little bit, push the catheter forward, just so he doesn't get blood everywhere. I'm going to put my 2x2 underneath that, and then I'm going to stabilize it and pull out the needle. And then we'd retract that and put the sharps. And then we can aspirate, but we can see that he's bleeding clearly, so you don't have to aspirate. Move our 2x2 to the side and release the constricting band. Then we will flush it. throw that in the garbage. Make sure that his IV's not going anywhere. Just clean the blood off so that way the tegadermal can actually stick to his arm. Then we can label and date the tegaderm too, so that way they know when it was put on. You want it on, so that way it's just covering the catheter. And so you could label it now. And we'll just put this over here to secure it to his arm. A little too sticky. Get a new piece of tape. And then you can tape this to his arm also. And we'll close the clamp. And if you see blood in the tubing, then you can flush it with another saline to get the blood out of there so it doesn't coagulate or anything. And be careful with the sharps. So we're going to lower him back down into a comfortable position and change our gloves and wash our hands too. And for considerations across the lifespan, if it was an older person, you can pull tension or pull taut in different directions. So when I was doing the IV, I pulled taut directly down, but if it's an older person, you can pull from the sides and down, or you can pull straight down and then pull up, so that way to get all that loose skin out of the way. And for infants, maybe you'd want to have somebody else there to hold them down because they're not going to understand anything. So just make sure that you have enough hands. And then documentation, we're going to go and document the size, the gauge, the location, the name, my name, who inserted it, today's date, and if the catheter was intact, and then what's covering it, and if it's infusing or not. So it's just a saline lock, so it's not infusing or anything. We're going to clean up our mess. And be careful. Yep, so I guess I can clean it up. We'll wash our hands again.
Done?
I think so, yeah.
Take a bow. Let me know you're done.
I'm done.
All right.